Now that your surgery is behind you and you are recovering, we will talk to you about the rest of your hospital stay and prepare you and your family for going home. Good nutrition is essential for healing to occur. Some people continue to have a poor appetite toward the end of their hospital stay and after they have gone home. Some suggestions for poor appetite or nausea problems are: eat small, frequent meals. Eat after you rest when you have more energy. Eat nutritious snacks between meals. Try liquid supplements such as Carnation Instant Breakfast or an Ensure type product. Limit foods with strong odors. Try cold foods. Drink liquids at the end of a meal to avoid feeling full too quickly. It is important for you to eat even if you don't feel like it. You will need to eat to heal. This will help you regain your strength. For the first 4 weeks, you are encouraged to eat a well-balanced diet with a few limits. Good nutrition is important for everyone, but it is especially important after surgery. During the first 2 to 4 weeks of recovery, you need extra calories and protein to help your body heal. If you don't have someone to help you with meal preparation, use convenience foods. Some examples are frozen meals, cottage cheese, pudding, string cheese, yogurt, canned fruit, and pre-cut vegetables. After that time, we recommend a heart-healthy diet. If you have diabetes, it is important for you to follow the necessary dietary restrictions to control your blood sugars. When blood sugars are too high, the healing process is slowed, and you may be at higher risk for infection. If you are experiencing constipation, you may try increasing your fluids, eating more fruits and vegetables, or using an over-the-counter stool softener. You could check with your local pharmacist for a recommendation. Check with your doctor whether you should limit or avoid alcohol during your recovery. There is information regarding diet in your teaching materials, and dietitians are available for instructions. Just ask your doctor or nurse. As you recover, your doctor may adjust your medications. Surprisingly, you may no longer need all the medicine you took before the surgery, but some patients will need to continue taking heart and blood pressure medicine. Your nurse will tell you about each medicine as it is given to you. Before going home, you and your family will be given information on each of your medications, including what they are, what they do, and when to take them. It is important for you to understand that after you go home, your doctor may still be making adjustments with your medications. Always contact your doctor if you don't feel well on any medicine. Never stop taking any ordered medications unless your doctor advises you to do so. You are encouraged to keep an updated list of your medications, including the names, doses, and frequency with you at all times. This assists your doctors and any other healthcare providers to better care for you. You may begin noticing a generalized body aching and tiredness in the first few days after your surgery. This is common and may last a few weeks. You have had major surgery and your body senses this. Do not be afraid that you are not getting better. Please let the nurse know about any pain, aching, or tiredness. The nurse will encourage you to take medicine to make you feel more comfortable. When patients are comfortable, they rest better, move about easier, and generally get well quicker. When you get home, you may do more and be more sore and tired than when in the hospital. Some people develop new aches and pains they had not experienced before. It is common and temporary for the neck, shoulders, and back to be sore. Numbness, burning, and shooting sensations in the incision areas are also common and temporary. These are some tips to help you be more comfortable. Try to relax. Change positions often. Use extra pillows to rest with. And take the pain medicine at regular intervals as directed by your doctor. Regular use will keep you more comfortable. At first, use the pain pills during the day and at bedtime. This will ease your discomfort and help you to rest at night. Use over-the-counter pain medicine for discomfort with your surgeon's approval. Discuss with your surgeon which pain medicines he advises for you. After you go home, gradually resume the daily living activities that are normal for you. Start slowly. Rest when you feel tired. Expect to tire with everything at first. This is normal. Remember, this is temporary. Look for improvement each week rather than every day. Avoid strenuous exercise and work. Do not lift, push, or pull on objects weighing more than 10 to 15 pounds for 1 to 2 months after your surgery. Do the exercises described in your teaching materials 1 to 2 times each day for 1 to 2 months. This stretching and moving helps to reduce soreness. Exercise and activity improves blood circulation and keeps your joints limber. Even though you feel weak when you go home, you should take several short walks each day. This will help you to build up your strength. Stand up straight. Don't slump, even if you are sore. Walking straight gives you better balance and helps you expand your lungs. Plan daily rest periods during the first several weeks after recovery. Sleep where you are most comfortable, your bed, couch, or reclining chair. It is normal to be concerned about resuming sexual activity after cardiac surgery. Most couples resume sexual activity as soon as they feel ready. There is no restriction unless your doctor tells you so. There is more information given to you in the teaching materials provided by the cardiopulmonary rehab staff. Your nurse and the cardiopulmonary rehab staff will teach you how to take care of yourself at home as they take care of you in the hospital. The cardiopulmonary rehab staff are part of your recovery team. They will give you teaching materials before surgery and has lots of useful suggestions and tips for you. This information you will need to know for your recovery at home. It includes exercise, activity, and healthy food guidelines. As you recover, special attention is given to your incision to make sure it is healing. Any visible sutures or clips are usually removed 5 to 7 days after your surgery. Your nurse will arrange for an appointment for you to have your sutures and/or clips removed, if not removed, before you go home. The wire used to close your breastbone and allow it to heal is permanent and will not be removed. It is important to wash your incision every day. You may shower or take a sponge bath, but should not take a tub bath until your doctor gives the okay. Showering can be tiring, so someone should be nearby to assist you if needed. Use soap without perfumes or lotions, such as Dial, Zest, or Ivory, to gently wash your incisions, using a fresh washcloth each day. As you wash, check your incisions for any changes. Wash the incision on your chest first. Gently wash from top to bottom. Carefully wash over each clip, stitch, or tape. Do not become concerned if the tape comes off. Then gently wash your leg incision in the same manner. When done, pat dry your chest, then leg incisions. Remove the strips of tape that cover your incision when you are directed to. This will be written on the incision care sheet. It is easier to remove the tape after you wash. Do not use peroxide, powders, salves, lotions, or ointments on your healing incisions unless instructed by your surgeon. Ideally, your incision should be left open to dry. A Band-Aid or gauze may be used for a couple of hours daily, only if there is drainage. Do not pick at scabs. Allow scabs to fall off naturally. It is important to call your surgeon if you see any of the following signs of infection: abnormal swelling with pain, new or increased redness, separation of skin, new or increased drainage, bright red or pus-like drainage, fever of 100 degrees or higher. It is not unusual to have bloody fluids leak from your chest tube sites with coughing or moving for the first 7 to 10 days.
Elevate or raise your incisional leg for 30 minutes twice each day until you see your surgeon. Most people do this while they rest. Your leg must be about 24 inches above the level of your heart when you lay flat. For example, you may lay on the sofa or floor and rest your leg on an inverted laundry basket.
If your legs were wrapped in ACE bandages while in the hospital, the ACE bandages should be used as you have been instructed. Starting at the foot, gradually wrap the bandage around the foot and continue up the leg to the thigh. The bandage should be snug, but not too tight. It will probably loosen up during the day and will need to be rewrapped a couple of times each day. ACE bandages should be removed at bedtime each night. Wear the bandages as directed until you see the surgeon.
The ACE bandages may be washed by hand or machine. We recommend washing them in cold water to remove stains, soil, or drainage, and then allowing them to air dry. Some people feel their legs are itchy when using the ACE bandages. You can apply hand and body lotion to reduce the itching, but avoid using powder. Lotions and ointment should not be applied to the incision areas.
You may be surprised that coughing, deep breathing, and using your lung exercise machine are still important. Mucus continues to be produced by your lungs. The breathing passages must be cleared so you can breathe more easily. Plan to do these breathing and coughing exercises 3 times each day for 1 month after your surgery. So keep that heart hugger pillow handy and use it when you cough to support your chest. If you smoke, your doctor will advise you to quit. You will be advised to not allow friends and family to smoke around you. The secondhand smoke you breathe causes blood vessels that feed your heart to narrow. When these blood vessels are narrower, less oxygen is available to feed your heart. There is information about smoking in your teaching materials. Ask your doctor, nurse, or the cardiopulmonary rehab staff about programs to help you quit smoking. Several days after surgery, you have done it all. You have coughed and taken more deep breaths than you wanted to. You have exercised and walked. Then comes a touch of the blues. It is common for people to cry more easily or to be more emotional after any major surgery. It is also common to have trouble remembering or to keep your mind on things. Some people have bad dreams. These things are related to anesthesia, medicine, and loss of sleep. They will usually pass by the end of the recovery period of 4 to 6 weeks. If you would continue to feel blue or down, talk to your family, friends, or doctor. If these feelings interfere with your recovery and do not pass, please talk to your doctor. Discussing everyday problems and concerns with friends and family will not slow your recovery. Usually, people describe recovery as a roller coaster ride. They have good days and lots of energy, do too much, and then feel sore and lousy the next day. We encourage you not to expect improvement every day. It just doesn't work that way. Instead, look for improvements on a weekly basis. But you need to know when to call your doctor. Some important things to note and call your doctor about include:
your incisions show signs of infection, abnormal swelling and pain, severe redness, separation, drainage, or fever of 100 degrees or higher, return of angina or chest pain, dizziness, rapid heartbeats, swollen ankles and or feet, weight gain of 5 pounds in 1 week or less, increased difficulty breathing, nausea or vomiting which keeps you from eating, diarrhea which lasts more than 24 hours, or ongoing constipation.
Your family and friends may feel responsible for getting you well. They are certainly wonderful to help you, but they can't make you well. Getting well and recovering is your job. Your family and friends may be afraid to leave you alone at home while they do errands or go to the store. You are sent home from the hospital when your condition is stable. Many people live and stay alone after surgery. They have family and friends come in to help them as needed.
Your surgeon and the resource case manager can help you make arrangements to go home. Please let us help you get everything set up before you go. Your doctor recommends that you attend a cardiac rehab outpatient program after discharge. This program will provide reassurance and support to both you and your family. Specially trained therapists will provide personalized, monitored, medically prescribed exercise and education. You will slowly increase your exercise tolerance as you progress through your recovery and rehabilitation.
There are choices you will need to make about food, habits, stress, and exercise. It can be pretty overwhelming, so much to do, so much advice. This is a new opportunity and a new life. Take time, enjoy, and celebrate each day. Enjoy your friends and family. Find time to have fun and laugh. Remember, laughter is always good medicine. Now is your time to smell the roses, allow yourself to heal, and exercise your way to good health. Be a friend. Ask family members and friends to walk or exercise with you. Ask them to think about making healthy changes to lead a heart-healthy life with you. And together, as a team, you'll be able to mend your broken heart.
Someone